All right, a lot of changes with Medicare for 2025. Let's talk about that today. My name is Ed Weir, former manager of the Social Security Administration. This is a live broadcast, as you can tell. No fancy studio here. So, we're going to talk about that and what you need to do. A lot of changes here, and it's kind of a moving target. We're not sure 100% exactly all of the changes for 2025. We won't know that until basically October 1st, but I just wanted to give you a heads up, and that way you can be prepared of what is coming down. So if you have, and this is a live Q&A as well, so if you have questions, make sure you type them into chat. And this is all things Social Security, Medicare, disability, retirement benefits, spouse benefits, survivor benefits. Let's make sure you're getting all the money you're entitled to, that you earned, you paid into all those decades for you and your family. If you're about to file, let's make sure you're doing the right thing. Okay, all right. So all kinds of changes happening here. Center for Medicare and Medicaid Services is trying to pass regulations. Unfortunately, the Supreme Court has now kind of pulled that out of their jurisdiction in some respect. So we're seeing a lot of stuff happening. One thing they tried to do was crack down on steering, where Medicare insurance agents and brokers and health insurance companies, the big ones, would pay agents and brokers a little bit extra for doing a little bit of administrative paperwork, and they paid them a little bit extra. So some unscrupulous agents and brokers were steering people to Medicare Advantage plans, Part D plans, whatever the case may be, that maybe might not have been the best for them, but it was best for the broker or the agent because they got a little bit extra money. Medicare came down and said, no, you can't do that anymore. We're not going to allow that. Unfortunately, because of that new Supreme Court ruling, Medicare was kind of hampered by a Texas judge. A Texas judge came in. Obviously, a lawsuit happened. Health insurance companies, Medicare insurance companies fought and say, no, we don't want that. So a Texas judge came in there and said, no, they put an injunction on that. So unfortunately, if you're gonna get help from an agent or broker, and they don't charge anything, I put together a team of brokers as well that can help you find the best Medicare Advantage plan, because I was tired of all the unscrupulous and people doing the wrong thing. So if you need help, make sure you reach out. But get with your agent or broker, someone you know and trust, and then ask them, okay, how many plans do you represent in my particular area? And that way you can get the best. So just kind of buyer beware in that respect. Hopefully, something happens with that. But there's still an injunction on that. All right. Another thing that's happening is, in the middle of next year, you're going to get a mid-year notification, and everybody gets a notification in September. Next month, you're going to get a notification. It's called the ANOC, the Annual Notice of Change. So the Annual Notice of Change, if you have a Medicare Advantage or a Part D plan or whatever the case may be, they have to send you the Annual Notice of Change, everything that's going to change for 2025. And this year, I mean, if you've always thrown that away for the last few years, okay, it's a pain in the butt, I understand. But this year, you really need to check it out, because there's so many different changes, and the Annual Notice of Change this year just might tell you that they're pulling out of your area because of all the different changes. Big Medicare insurance companies have already notified CMS, and you probably see it in the news. They're like, yeah, we're not making any money in this area. We're not making any money in this rural area. We're not making any money out in the desert out in the West. So millions of people are going to be losing their Medicare Advantage plans. And how do you know that? Well, you check the Annual Notice of Change. But unfortunately, a lot of people don't check that, and they, starting January, you go in there and to your doctor, and you find out you don't have a plan anymore. So it's very, very important you check that letter. And when you get that letter, keep it, save it. If the letter says that they have pulling out your area, and you're done, then again, January 1st, you're not going to have another plan. You're going to have to pay all the gaps that original Medicare doesn't pay. The original, the 80, you have to pay the 20%, Medicare will pay 80%. You have to pay 20%. You have to pay over $1,600 if you go to the doctor and all that kind of stuff. So that's important that that doesn't happen. And so you have to make sure that, and if a company pulls out of your particular area, you get a guaranteed issue for a Medigap plan, one of the Medicare supplement plans. Those are the ones that, you don't have any networks, you don't have prior authorizations. There is a monthly premium for those, but a lot of people want to get on those. I get calls every single day. People say, I want to get out of my Medicare Advantage. That's too much of a nightmare, all the pre-authorizations, and they're not covering my doctors anymore. And they want to get into a Medicare supplement, but you can't get into a Medicare supplement after your original sign up unless you go through health underwriting. But if your company, your Medicare Advantage company, abandoned you, then guess what? You get a special enrollment period. So you get a guaranteed issue for a Medicare supplement plan. So make sure if you get that letter saying they're leaving you, make sure you save it. And then when October comes around, then reach out to your agent or broker, or reach out to us, and we can help you find a Medicare supplement plan. And now no more networks, no more, all the pre-authorizations and all the rest of it. Another thing that's changing is, you probably saw this on the news, Medicare Part D. So Medicare Part D, the prescription drug plan, started in 2003. And the only reason it passed is because the pharmaceutical industry didn't want it to pass unless they profited. And the way it passed in 2003 is they profited big time. So you got a lot of people that weren't able to afford their prescription drugs, but the government came in and said, okay, all right, we need to get prescription drugs for people, so let's go ahead and pass it. And the pharmaceutical companies said, okay, all right, but you can't negotiate prices like every other country in the world or the Veterans Administration. And the only reason it passed is because politicians said, okay, we won't negotiate prices. And now people have been charged outrageous amounts, and government has been picking that up, and pharmaceutical companies have been making tons and tons and tons of money. Well, under the Inflation Reduction Act that was just passed a couple of years ago, guess what? Now Medicare can finally, after decades, I guess Biden the other day was saying he's been trying to do this since 1973. And you're saying, wait, Ed, that doesn't make sense. 1973 didn't have prescription drug plan under Medicare. Yeah, they did. It was under Part B. Part B, if you go into a doctor's office and get an injection or infusion or something like that of some type of pharmaceutical drug, then that's covered under Part B, and Medicare couldn't negotiate that forever. So he's been trying since 1973. So it gives you an idea of how long it takes to do stuff. And pharmaceutical companies, they put out over $400 million in lobbyists to stop this Inflation Reduction Act, to stop the ability of Medicare to negotiate prices. But fortunately, they lost. So starting next year, there's a cap on prescription drugs. So the old donut hole has gone away. The max you can pay out of pocket is $2,000. But unfortunately, because of that, these companies, they don't get to be billion-dollar companies for nothing. They have other ways to kind of get some money, and that's what they're kind of trying to do now. And so you see the health insurance companies, they're going to be reducing benefits, increasing, kind of out deductibles and different things. So unfortunately, this is why we really need to be vigilant this year, that your plan with Medicare supplement, you don't have to worry about it. If you have a Medicare supplement, you are good. If you have a G that's getting kind of expensive, you might want to consider switching to another G that's a little bit cheaper on a monthly premium. If you have a G and you really want to save some money, you can switch to an N, usually about 20% cheaper per month for the premium. And you can do that. You can switch from G to G and G to N any time of the year. But you still have to go through health underwriting. So if you're youngish, 65, 66, 67, 68, whatever, and healthy-ish, check to see if you can switch and save some money there. But in terms of Medicare Advantage, you definitely need to watch out for your annual notice of change and see the reduction of benefits, the dental, vision, hearing, gym membership. The increase of cost last year was $100 if you had to go to the hospital a day. Now it might be $200 or $300. Again, they're going to be dropping areas. Millions of people are going to be losing their plans. More prior authorizations, so for drugs and deductibles for drugs and formularies. So super long story short, this is going to be a terribly complicated annual enrollment period coming here. So we're talking annual enrollment period October 15th through to December 7th. Nobody knows what the plans look like in your particular area until October 1st. Everybody gets the plans October 1st. So please make sure you check out your plan and compare it. And just don't say, a lot of people think that, okay, I've got XYZ Medicare Advantage plan, Medicare company, and I like them. Okay, that's fine. Perfect. You can keep that company. But that company, I almost guarantee, has 1, 2, 3, 4, 5, 6 different plans. And they're probably coming out with another plan next year because they always come out with a new plan, just like come out, new cars and new models. So they come out with a new model to entice new buyers to come over from another company to theirs. And what they're banking on is for you to just let it ride. And they slowly deteriorate your particular plan and give all the benefits you used to have to the new people in the new plans. So it's important that you check your old plan and say, hey, I'm going to upgrade to the new model and get all the other benefits everybody else is. But if you just let it ride, then it's going to cost you. It's probably going to cost you next year. And you don't know until you know. You're like, oh yeah, it's still same doctor, still monthly premium of zero. Oh, I'm good. Nothing changed. And then next year in February, March, April, you fall or get sick and you go to the doctor or something, and they're like, you get this bill for $500 and say, why have to pay for that? Well, should have checked your plan. So cautionary tale out there. So make sure you watch that, the annual notice of change. And then mid-year, that I continue that thread, next year in the mid-year, they will send you that benefit, that supplement letter that basically says, hey, you've got dental, you got $4,000 of dental, you haven't been using your dental. We just want to let you know the government has mandated those letters. And that's another reason these insurance companies are trying to save money in other places, because they've been offering all these benefits, gym membership and dental and vision and all this kind of stuff, and people have been using them, so the companies pocket that money. But now they're gonna have to make you aware of it, and they're gonna lose that money, because you're actually going to use your benefits. So that's why they're trying to find money from other places. Again, these are smart companies. They don't get to be billion-dollar companies for nothing, right? Okay, so let's go ahead and answer any and all your questions about Social Security. Let's see. Lenore Marie, hi. When can a disabled 61 ex-wife file for ex-husband's spousal Social Security? Husband is 64, still working. Okay. So disability, if you're disabled, you can file for benefits on your own record anytime, but you can't file for spouse. There is what's called a disabled widow's benefit. So if your ex has passed away, you can file between 50 and 60 for what's called the disabled widow's benefit. But that doesn't apply to you because you're 61, and it sounds like he is still alive and kicking out there. But it doesn't matter. It does not matter that he is still working. No relevance whatsoever. So you're single, and as long as your ex-spouse is 62 years old, you can file for benefits on his or her record. It's called independently entitled divorced spouse. And let me, the problem is there's the Social Security is so understaffed, and there's some people, particularly at the front windows, that they're not experts. You really have to schedule an appointment to talk to someone, a Title II claims specialist. I'm going to put the link. So I'm putting the link right now. It's called Independently Entitled Divorced Spouse. and have that link, have that reference when you go into the local office. Because if you go into the local office and you say, "Hey, I want to file for benefits of my ex-husband," and and say, "Well, they haven't filed yet, so you can't file," then give them that link or give them that reference, and they will get you set up. Yeah, I've had too many people go into the local office and say, "Ed said I could file," and the person at the front office said, "No, you can't." So I'd send them a link, and they go back in there, and they'd get their money. So let's see. I just had steering happen. The broker I was working with couldn't give me hardly any info because they said SSAs said they couldn't. Wow. Yeah. Yeah. SSA has zero relevance, zero impact on Medicare insurance brokers. It's Medicare, but not sure what the person said, but yeah, Medicare is extremely, they're Medicare insurance brokers or agents are highly regulated. I always give the example of, you go into, Walmart or wherever, your local pharmacy, and you see someone set up with a table that says Medicare, ask me about Medicare. That person doesn't, look in your eye, or they're just sitting there, and you're like, wow, that person is a bad salesman. No, Medicare, that has a little button that says "Ask me about Medicare," because they cannot walk up to you and say, "Hey, how you doing? How's your Medicare plan?" They can't do that. That's illegal. They can't knock on your door. That's illegal. You have to actually ask them about Medicare. The words Medicare essentially have to come out of your mouth in order for them to start talking about Medicare. So it's highly regulated. But yeah, steering, the difference between an agent and a broker, a captive agent, a stereotypical captive agent works for one company. So when you contact them, guess what company you're gonna, their company. A broker is contracted with many different companies. They're licensed in your state and they're contracted with many companies. So they basically work for you. So you call them up and say, "Hey, what's the best plan in my area?" And they will tell you. But they also have to tell you whether they're licensed or contracted with every company in the state. And most brokers are not, because there's some companies in particular areas that are just terrible. That no brokers like, "Yeah, I'm not even going to get contracted with that company because it's terrible, because they have terrible plans and there's nothing, nobody ever gets those." So yeah, so the person will tell you that I'm not, I'm not licensed and contracted with every, plan in your area. And usually they're contracted with the best ones, because, they want to essentially, make the sale, and you don't pay them, the company pays them directly. And it doesn't matter what company it is, they pay the same, except for that little administrative fee some of the larger companies pay. But yeah, Medicare was trying to stop that, but Texas judge says no. Can I switch to traditional Medicare from a Medicare Advantage? Yes, it really depends on your health, though. It depends on their special enrollment periods. If again, if your Medicare Advantage plan leaves your area, then you have a guaranteed issue. But you can't do this until October 15th, because your Medicare Advantage plan is good for 1 year. They're only good for 1 year. There's nobody that's been on their Medicare Advantage for more than 1 year. You might have the same card and stuff like that, but those plans change every year. You have the same doctor, same card and everything, but it's a completely different plan. Something has changed in that plan. So all these plans are only good for 1 year. So you have to wait until your current plan expires, unless you move or something like that. So yeah, around October 15th, reach out to us, call that number, email me and say, "Hey, Ed, in October, put me on your list. Let's review my plan in October and see if there's anything better, or let's see if I can switch to a Medicare supplement plan." And then if you switch during that time, October 15th to December 7th, your new plan will start January 1st. Disgusting. Tax the darn billionaires and close their loopholes. Yes. That's increasing the FICA tax. Yes. Guaranteed enrollment due to losing insurance. It is now. Will everything change on me in September? Yeah, not sure. Yeah, usually if what I meant by losing insurance is if they pull out. They can't pull out of your particular area now because, again, these plans are good for 1 year. So if they send you the letter that said we're pulling out, then that means they're not going to renew your plan January 1st. But if that's the case, you can't get a new plan because we don't know what new plans are until October. So you have to wait till October, unless you move or something like that. You're going to a new area, then yes. Let's see. My husband's Medicare supplement just went up $50 a month, making it over $200 a month. Yeah. The Medicare supplements, that's why a lot of people choose Medicare Advantage plans, is because they got the zero premium per month. And people that are paying $200 a month for the supplement, they're like, oh gosh, my next door neighbor is only paying zero, which yes, but they're getting charged other places. So if they have to go to the hospital, they might pay a few $100s, get a CT scan, they got to pay this. And if you have like a Medicare supplement plan G, your deductible is $240 a year this year. So if you have $1 million treatment, guess how much you pay? $240. And you can go anywhere in the country. And you don't need any, no networks or insurance companies delaying your help, your any of that. So yeah, unfortunately, there's a price for that. I wish it was different. I would design the system differently, but this is the way the system is set up. But yeah, if your Medicare supplement plan is getting too expensive, then if your husband is healthy-ish, then might be able to switch and get you a different plan. I also caution, if you're looking for a Medicare supplement plan in your area, they're in your state. There are some that are really cheap monthly premium. They have kind of like teaser rates, almost small companies. So I kind of avoid the smaller companies. I recommend the 4 or 5 bigger companies, because of the economies of scale. And then if you happen to move to another area, then you'll be good in that new area. But these smaller companies are trying to get people to join them, so they give you like a really lower rate, but then their prices go up considerably, a lot more than other companies over the years. So if you don't get your ANOC in the mail, is there a way to find it online? Yes. I'm about online. It really depends on the particular, because the ANOC, the annual notice of change, comes from your Medicare Advantage company. So you'll just have to reach out to your Medicare Advantage company and say, hey, I didn't get my letter in the mail. Send it to me. But again, starting in October, you can go online and you can see what the new plan is for 2025. Or again, yeah. Can you send a broker to me in Texas? Yeah, Lisa, just go ahead and email ed@mygovexpert.com and say, hey, Ed, this is Lisa from Texas. Put me on your list for October. And then when about the end of September, we'll start reaching out to people and schedule an appointment to see if there's anything better out there. Do you happen to know who or what office at United Healthcare to call for a serious dispute? I can only get clerks. You have an appeal right. You can always call Medicare directly. If you can't get any, justice, retribution, not retribution, but anything resolved, a reconsideration with your health insurance company, then the next option is to go to Medicare. And sometimes it also pays to, when you call that particular health insurance company, says, okay, well, the next call I'm going to make is to Medicare directly and complain. So there's that. I can barely pay the $174, much less a supplement. Yes, that's why 51% or so people pick a Medicare Advantage plan, because unfortunately they can't, they can barely afford the 174, and, having a Medicare supplement. That's why, it's unfortunate. I wish it was different, but, if you have the money, if it's in your budget, 100%, get a Medicare G or an N, and then you have to get a prescription drug plan. And but if it's not in your budget, then unfortunately a Medicare Advantage. However, if you keep up on it and if you play the game smarter than the insurance companies and you review it on a regular basis, then you should, yeah, you should be good. But it's the people, insurance companies hope you don't review it. They're like, please throw that annual notice of change letter away, ignore it, and we'll slowly downgrade your plan, and we'll make tons of money off you, and you won't be the wiser. So, but remember, Smiling too, the $174. Remember, I don't know if you're new to the channel. I don't think I recognize you, but it's the Medicare Savings Program. If you're having a really difficult time paying the $174.70 for the Part B, contact your state Medicaid office, Department of Social Services, Welfare, whatever they call it in your state, and apply for Medicaid. And if you're approved, they will pay for your Part B premium. It's called the Medicare Savings Program, and you'll get a lot of other benefits. And if you're approved for Medicaid and Medicare, which you can have both, millions of people have both, you become what's called dual eligible. And then you have dual eligible Medicare Advantage plans that you can choose from. And those, depending on your area and everything, those usually have the best benefits, the most coverage, the least cost out of your pocket. So contact Medicaid and ask them, hey, I'm having a hard time paying my $174. Can y'all hook me up? No one will ever get to a $2,000 drug limit. That is, yeah, a lot of people get to that. Yeah, Lori, you're going to get a lot of flack for that, considering what the diabetes drug was. Yeah, $500 or something. And part of the Inflation Reduction Act, let me put this up here. These are the new drugs. Let me go ahead and share my screen here. And these are the new drugs, the new prices. Unfortunately, pharmaceutical companies negotiate and they say, hey, don't do it quick, because we want time to, pay off more politicians. So it won't start until 2026. Oh, let me take away this thing up top here so you can actually see it. So this won't start until 2026, but these are the drugs. Eliquis, right now, or last year for 30-day supply, paying $521. Now, $231, so 56% savings. Jardiance, Xalto, Januvia, Farxiga. Oh, a lot of people taking this one. This is all the people. This is the Eliquis. 3.9 million people take this one, so they're going to save 56%. All these drugs. So these are the 10 drugs that were negotiated. This is a big one. A lot of people I've talked to get the Flexipens and different things. They're paying $495. So now there's going to be a 76% savings on those. So these are the first 10 drugs in 2026. And then after that, they're going to pick another 10 drugs and then 20 drugs after that. So yeah, so this is a very good thing. But unfortunately, the insurance companies are, fighting back a little bit and, trying other ways to get more money. But as long as we're savvy about it and don't let them get away with it, we should be good. You should be good. When they are paying out billions in fraud, the U.S. has no right to raise prices or cut coverage. It is unethical. Yeah, these are private insurance companies that are raising these. Let's see here. I've been on Plan G. Can I switch to N without going through underwriting? It depends if you're in a special enrollment period, but if not, like you recently moved or something like that, then you'll have to go through underwriting. And underwriting, health underwriting, is not as difficult. It's basically what happens is you call a broker and they say, okay, in your particular area, these are the three best national companies, and this is the three best prices. Because when you're shopping for a Medicare supplement plan, you don't care about the details, you just care about the price. And then whether it's a big company that is going to raise prices a lot, because a Plan G is a Plan G is a Plan G. It doesn't matter. A Plan N is a Plan N is a Plan N. So there is no how much are they going to charge for this? How much? They're all the same. So the only thing you're looking at is price. And And then if you have to go through health underwriting, then the person, you say, okay, I want this company because this looks like the best company that's going to have the stable rates. Let's do that company. And then the broker will ask you while they're taking the application about 30, 35 questions. And have you had a heart attack in the last few years? Are you going through chemotherapy and stuff like that? And if you answer no to all of them, and some of them you can answer yes, there's usually like two categories. Like the top category, if you answer yes to any of them, are you going through chemotherapy? Then you put yes, and then you're denied. Um, if you've been to chemotherapy, like it was like 3 years ago or 5 years ago or something like that, and everything is good now, then you're good. And then there's another category under it. This, do you have high blood pressure, or do you have diabetes or something like that? And if you, I've got diabetes, okay, well, you do. How much of insulin do you take? And that's even if you have diabetes, then it depends on the insulin. And each company is a little bit different. So you answer the 30, 35 questions, takes about 10 minutes. And then they submit it to that particular company, and the company, they say yes or no. And usually the brokers, if they're really, really good, which everybody on my team is really, really good, that's why they're on my team, is you know, they ask you kind of the questions, and yeah. So yeah, this company that you like is a little bit cheaper, but I know with your particular, you had this issue 3 years ago. They look back 3 years ago, but this other company doesn't look back 3 years ago. They only look back 2 years ago. So they can find a plan that is good for you and might be able to get you in there. What is the maximum age to go on disability? Basically, all the way up to your full retirement age, whatever your full retirement age. So 65, 66, 67, or whatever. Why even I have Medicare plus my insurance from city job I get bill I didn't get. Oh, I'm not sure what that means here. My wife is 63 and does not have 40 quarters. Yeah, if she doesn't have 40 quarters, no problem. Then she can get spouse benefits from you, but you have to file for benefits first. So once you file for benefits, then she can get benefits as a spouse on your record. Yes, Deb, my meds are a month. They're way over 2,000. Yes, I knew that was coming. My friend is 66. He was on disability until 4 years ago. He wants to get back on. Yeah. Can he do that? No. Um, uh, because 66 sounds like he's been disability, so his full retirement age. He's probably he's probably at his full retirement age, or very, very close. But what happens is everybody that's on disability, once you're on disability, your disability benefits switch to regular retirement benefits at your full retirement age. So most people don't even recognize it. So nobody, if your full retirement age is 66 and 6 months and you're on disability, you're no longer on disability. You switch the day you turn your full retirement age, you switch to regular retirement benefits. And most people don't even recognize the switch, because the price of your benefit amount stays the same, and your direct deposit stays the same, and all that. But now you don't have to do any medical reviews, and you're not limited to work and all the rest of that stuff. So that's always a beautiful thing. All right, let's see here. The state of Georgia is starting its own Medicare and drug enrollment separate from the federal website. Opinion. You're probably talking about the Affordable Care Act. Yeah, they don't do it. Yeah, Medicare is a national program, but the Affordable Care Act, marketplace insurance, Obamacare, yeah, that's a different process. So, yeah, some states, the Affordable Care Act thing is, each state did their own thing. So that's kind of confusing depending on the state. But Medicare, yeah, they wouldn't set up a separate Medicare website. So they might be setting one up to kind of help you navigate Medicare, but not to enroll. You enroll in Medicare through Social Security. 62 was on workers' comp, had to retire. Settlement mentioned Social Security offset. Will this lower my SSDI if I get approved? Possibly. What it is that Congress decided that if you are receiving Social Security disability insurance and you also receive a public disability benefit or workers' comp type thing, you shouldn't make more while on disability than you were when you're working. So they do a calculation So for instance, if you were making, $3,000 a month when you were working, and then you get 2,000 from Social Security and 2,000 from workers' comp, now you're making 4,000. You're making more than you were when you were working. So that's kind of where that's the nature of the offset. So they just might offset it. But if the disability is coming from like a short-term disability from your company or pension type thing, then that doesn't count against it. There's no offset there. Do you have a personal belief that there's a best time to take as for someone who isn't experiencing anything financially or medically? To personal belief that there's a best time to take, are you talking about Social Security retirement benefits? Um, um, no, because it really depends on each person's particular situation. Um, so I have a problem with TikTok here. So I'm just gonna, everybody on TikTok, come over to YouTube. Anyway, so it really depends on your particular situation. So you're saying you don't have any financial issues, and medical is not an issue for, obviously Social Security. Um, you'll get Medicare at 65 regardless. But yeah, if you can delay filing for your Social Security benefits, your benefits go up every single month you delay retirement until you hit your full retirement age. And even after your full retirement age, your benefits continue to go up. You get those delayed retirement credits, which is 8% per year. So you wait till 70, in 3 years, 24% increase. So yeah, if and it also depends, your health and longevity in your family and all this other. There's just too many variables. So all right. All right. So someone else is saying another company is increasing their uh, yeah, another $20 or so. Yeah, there's going to be unfortunately a bunch of increases. Again, this is the year. If you haven't done anything, if you've kind of, kicked the ball down the road on all your Medicare, everything, this is the year to do it. If I select a new Medicare Advantage for next year, do I have to cancel my current Advantage plan? Nope, that's automatic. When you sign up for a new Medicare Advantage plan with the same company, a different plan in the same company, or you switch to a different plan in a different company, the broker, if you have a broker help you, then they do the application and it automatically goes to Medicare to confirm your Medicare number and all that kind of stuff. And then Medicare has a central database where they notify your current plan that you will not re-enroll, because if you don't do anything, you automatically get re-enrolled. But if you switch, then you don't have to contact the new place. I signed up for Part G and was told the company was the lowest cost, but I checked with ARP, their United Healthcare is cheaper. He was leaning towards United, but said it was more. Can I switch myself? Yeah, yeah. Lowest cost, but I checked, and the other one was cheaper. So yeah, I'm not sure why, because that neither of those companies, when you sign up for a Part G, I don't think there's any price that they get any more advantage one way or the other. But yeah. So yeah, that's it depends on how long ago you enrolled. So yeah, I would definitely check it out, because the company you're talking about is the largest in the country, and they usually have the best, long-term price increase in terms of the lowest. Let's see, Stephen. I hope I'm trying to avoid company names. I always try to try neutral and company names here, so I try to get around the questions. My provider doesn't. I hope my provider doesn't pull out of my area, which is North Carolina. Yeah, it really depends. They will do the number crunching, and it's they'll look at it and see if there's any more, if they're losing any money in that particular area. And again, remember, they're probably not going to pull out of your area, but they might drop particular plans, or they downgrade your plan to such an extent that it is profitable for them. So if your particular plan isn't profitable for them, they're going to make it profitable for them, and they're going to, they're not going to, they're smart. They're not going to raise the premiums from $0 to $100 to make profits, because then you'll just, buy. So they don't do that. They change everything under the hood. So, and you don't find out until you find out, unless you look. So next year, all of a sudden you go to the hospital, and now it's $300 a day instead of $100 a day. You get a CT scan, it's $500 versus it was $50 last year. So that's where they get you. That's where they get you. And they hope you don't spend the couple hours with a broker and, or, do it yourself or whatever. And yeah. What do you think of a presidential candidate's proposal to not tax Social Security? Um, I like that idea. I never thought Social Security taxes should have been taxed like that. That was passed in the 1980s. But now that it is, there's billions of dollars that come in every year to the Social Security Trust Fund. So unless this particular presidential candidate has a plan to compensate for that loss of income, if you just stop the taxes, then that's going to cut our benefits sooner for everybody. So right now we're looking at about 2034, 2035, there's going to be a 17% cut. And if the taxes are done away with, then it's going to come in another year and probably, go 20% cut for everybody across the board, because that is income coming in. And unfortunately, that particular presidential candidate does not have a plan. They just, populist, trying to get votes. I'm turning 65 in September and still working with good health care benefits. I plan to retire next year. Should I sign up for Plan A now? So if you turn 65 in September, you're still working. No, you can if you want. It depends on your particular health insurance and your particular company. If your company has a big deductible when you go to the hospital, might be a good idea to go ahead and sign up for Part A, because Part A probably has a lower deductible, and it's free. It's zero premium. It's not free. You've paid for it over those decades, but it's zero premium going forward. And then and this is all. So this is from current work. So you don't have to sign up for Medicare Part A or Part B unless you have if you have health insurance from current work, yours or your spouse's, and your employer your group health plan has to have 20 or more employees. And if that's the case, no, you do not need to sign up. If you're currently receiving Social Security benefits, they're going to sign you up automatically. And then, at that time, you just go ahead and deny Part B. But no, if you have health insurance and you're happy with it and it's good, it doesn't have a crazy deductible, you don't have to do anything. Once you stop working, about a month or two before you stop working, then go ahead and sign up for Medicare. That way, one day your health insurance from work stops, and the first of the next month, your Medicare and Medicare supplement or Medicare Advantage, whatever you choose, starts. Ed, in your opinion, is government paid healthcare feasible? Oh, we're talking like a Medicare for all type of thing. Yeah, there's a lot of countries throughout the world that do it, and people always take the bad examples. Like we've got tons of bad examples in our country of our healthcare system, but like Canada and Japan and different countries, and I think we can do better in terms of waiting time. I know, in Canada and Japan, it depends. I know in Japan, yeah, it's an awesome system. And in Canada, it depends on the particular province. Like they always give examples of Ontario, but if you go to other provinces, the kind of the health insurance for all yeah, is not that bad. It's very good. A lot of people like it. So yes, just like you, smart charging your subscribers for private chat. You're greedy. Well, just like, yeah, 99% of my help is free, but yes, I guess I'm greedy or whatever. My wife said I can no longer use our retirement money for this. So if I do charge $99 for a private call, I guess I'm a capitalist pig. So sorry about that, but I do all these for free. Yeah, the 99, I've done over 600 videos to help y'all navigate the system. So Ed, the Medicaid savings plan only help those who are not over the Medicaid limit, correct? Which is way too low if you ask me. I agree. My Social Security payments is way over the limit. I am going to try out Advantage for a year. Yes. Yeah, and you have a trial. Make sure you confirm with your broker, but usually with the Medicare Advantage, if you switch to a Medicare Advantage and you don't like it, you can switch back to a Medicare supplement for a year. But yes, yeah, the Medicaid, because it is a welfare-based program, yes, there are income and resource limits, and the income limits, depending on the state, if if you're single, making over 15, 16, $1,700 a month, then yeah, you're not going to get into the Medicaid. I agree. The level is way, way, way too low. All right. The 2000 D limit is for subscribers out of pocket costs. Yes, max out of pocket. Right. This year is like $8,000. And before it didn't really have a limit. And yeah, so now they're bringing it up there. Uh, you're on the list for my driest humor. Yeah. Yeah. Sometimes my Marine Corps humor gets out there, but that usually offends people. So I try to keep that one suppressed. I have Plan N in New York. Ooh, I know where this is going. New York has the most expensive Medicare supplement plans in the country. That's because they do it right. If every state in the country did it like New York, then we would be so, so much better. Go figure. Because in New York, you really don't have that medical underwriting. New York says, no, you can't discriminate against people based on prior, conditions and stuff like that. So when people throughout the country, in Arizona or wherever, Kansas, and they get really, really sick and they want to switch to a Medicare supplement plan, some people have moved to New York and then they get a Medicare supplement plan and then they go see the doctors what they need. So yeah, okay. Let me finish this. I have a Plan N in New York and want to move to Virginia. Do I have to go through underwriting to stay on the plan of Virginia? No, you just go down there. You have to re-rate because you're moving. So you should be good. But insurance is regulated by the state. That's why each state is a little bit different. You have states like New York do things differently, and some states have like a birthday rule that you can change during your birthday, or they have an anniversary rule that you can change on the year anniversary you did certain things. So each state is a little bit wonky because Medicare all insurance is regulated by the states. So auto insurance and life insurance and burial insurance, and that's one of the things that burial insurance companies kind of use. They say, hey, they send you all the stuff you see on Facebook, and they send you these, flyers and says, hey, it's state regulated burial insurance. And you're like, oh, state burial insurance. Oh, I get, burial insurance from the state for free, some subsidy or something like that. No, all insurance is regulated by the state. So yeah, and that's so I have a team that helps with that too, by the way, because I've seen the result of people, having to pay $10,000 for burial, and then I hand them a check when they came into Social Security. I hand them a check for $255, and they are not happy because that's all you get from Social Security is $255. Thank you for mentioning that Medicare and Medicaid, and I believe also TRICARE and Champus are not allowed to negotiate for lower prices. Patients with those programs can't use coupons either. Yeah, the VA can. Yeah, that's what's strange. That's why people that use the VA, the Veterans Administration medical facility, if they sign up for a Medicare Advantage plan, they sign up for a Medicare Advantage plan without the prescription drugs, because the prescription drugs in Medicare is terrible because they weren't able to negotiate. They always get their prescription drugs from the VA because it's so much cheaper because the VA is able to negotiate. Capitalist negotiations. I went to get my second check. I was informed I was wrong yesterday. Not sure what that's about. Can you have Medicaid and Medicare both? Absolutely. Millions of people have Medicare and Medicaid. Yes. So, and the states love that too. The states, if you're having an issue and you're on Medicaid and then you turn 65, the states love for you to sign up for Medicare, because what happens is Medicaid, it's, partly state funded, but also partly government funded, federal government funded. And so the states are paying for a lot for your health care. But then when you turn 65, they're able to, they will sign you up for Medicare. And then the federal government will have to take care of more of your health care, which the states save money. So that's the reason why the states like paying the $174 is because, okay, we can pay this person's health care, which is like $3,000 a month, or we can pay the $174 and the government, bureaucratic moving back and forth and all the rest of it. So Thank you, Edwina. Appreciate that. Penelope, let's see what she says. She's always right on there. Seemed like you skipped my question, Dr. Weir. Did you say that someone could apply for divorced spouse benefits prior to 62 based on them being disabled? It's called disabled widows benefits. And usually you have to be a disabled widow, and divorce sometimes, yeah. But between the age of 50 and 60, disabled widow. So if you're a widow of someone, can be divorced as long as you were married to that person for, the 10 years or whatever the case may be. And it a little bit more detailed in terms of the timing, a 7-year timing. But yes, if you are between 50 and 60 and your spouse has passed away and you're disabled, 100% go down to the Social Security Administration. Will schedule an appointment and file for disabled widows benefits, and you'll get 71.5% of the deceased number holder's primary insurance amount. Turning 65 next year, where do I start? So if you're currently receiving Social Security benefits, your Medicare will start automatically. You'll get the package in the mail about 100 days before you turn 65. If you are not receiving Social Security benefits, then if you want to go ahead and sign up for Medicare, Part A, Part B, or just Part A or whatever, then reach out to Social Security or file online and get that started. If you're going to do Part A and Part B, make sure you find out how you're going to cover all the gaps, either a Medicare Advantage plan or a Medicare Supplement plan. So you are doing the right thing, Roy, by figuring out what you need to do now before it's too late. So let's see. So these companies are permitted to be very sneaky. Yeah, yes. That's where that $400 million of lobbyists paid into politicians come from. But welfare never gets cut or runs out. Well, no, they just welfare just continues to cut. Make fewer and fewer people eligible. Will your broker call you before your plan expires, or do I have to call them? That's one of the things I'm trying to think of. So you're talking about my broker or whatever broker. So if you have a Medicare Advantage, we're talking about Medicare supplements don't expire. People keep those for decades unless they're looking for a cheaper price. But particularly in the annual enrollment period, October, November, December, and particularly this year, it's going to be crazy. So your broker or our broker, whoever, I don't think is going to have time to reach out unless you reach out first and say, schedule me, because there's going to be tons of people that are going to need help this year. And that's one of the things that that Texas judge didn't put an injunction on. Center for Medicare and Medicaid Services, Medicare, came down and said, okay, we're going to stop all these health insurance people, Medicare insurance people, from calling you and harassing you 20, 35 times a day. And why that has happened is because you press a button on Facebook or return some postcard or whatever, however they get your name. That person paid for that Facebook ad. They paid $35 or $50 for that Facebook ad when you press the button. So they got your information. They call you up and try to sell you a Medicare Advantage or a supplement plan or whatever the case may be. And you say, no, I'm good. And then they just lost that money. So what they've been doing up until now is they take that information and they sell it to everybody in the country for a dollar here, dollar there, and get their money back. And then all those people call you and harass you. Medicare came down and said, no, you can't do that. If Kimberly tells Bob, the Medicare insurance person, to call her, then that's it. Bob is the only one that called. Nobody else can call. Bob can't sell Kimberly's information to everybody else and try to get their money back. Only Bob can call you, right? And the Texas judge, the health insurance company, said, no, we don't like that. But the Texas judge was actually good in this part. he didn't rule against that. So that is still, looks like it's still in force as of now. But you know, those health insurance companies are going to try to get those to, yeah, stop. But with my people, you don't call us first and tell us that you want to talk to us tomorrow or next month, then yeah, we don't call you. So I am currently on SSDI. Would an inheritance from my mother's death affect my benefits? No, not at all. The only thing it might affect is if you're receiving Medicare Part B, it might get you an extra premium 2 years from now. So it's called IRMA, Income Related Monthly Adjustment Amount. So it depends how that inheritance is, how much it is, and all those details. But your Medicare premium might increase in a couple of years. So make sure you check that out. How does the taxes we pay fund the Social Security system? I thought it was considered income tax and went to the general fund. Nope, nope. It's yeah. When I think I've got a chart on that. Let me see here. Yes, when you pay your taxes, and 85, it depends on how much you make, but up to 85% of your taxes your Social Security benefits, 85% of that is subject to taxation. And let me take this thing out of here so you can see. So this is what the general fund operations of the trust fund. So there's $1 trillion that comes in every year from just regular FICA taxes. And then here's the taxes on those benefits. So basically, when you pay taxes on those benefits, you pay it to the IRS, and then IRS credits that money to the Social Security Trust Fund. So for 2023, that was $49 billion. And then interest, the trust fund does earn interest, $63 billion last year. So 49, basically $50 billion comes in through taxes, and that helps the solvency and extend it. So if we in taxes, which I agree, I think that's especially for people that are struggling, then if that 50 billion goes away, then we're going to go through the trust fund quicker, and there's going to be more draconian cuts to our benefits in the future. So cutting the Social Security tax, okay, definitely, but what's going to make up for that? And if you don't have a plan to fill that gap, then you're just going to cut everybody's benefits. So there's that. Don, I'm homeless, can't apply for an account with Social Security. Any suggestions? Yeah, the local libraries have a computer, I'm sure. Watch my video I did on extra help. Let me see if I can find this up here. I'll show you okay, here it is right here. Watch this video. I did a longer one on this, on how to live on Social Security. There was like 4 videos I did on this. The introduction on the first video was way too long. Everybody complains about that, and it's like, hey, what do you do? Sorry, I'm new to YouTube. But this is an updated and expanded one. Watch this one right here, how to live on Social Security alone. And there's like 40, close to 50 different programs that might make your life a little bit easier. So check that out. And this is the one I did on 2 checks. People, that people can receive disability and survivor benefits. It's 2 checks. You get them at the same time, but it's essentially 2 different checks from 2 different programs. It's either, you're getting a check from disability and one from the retirement trust fund, or you're getting one from disability on your own record, and you're getting also another check from a deceased spouse or a current spouse or divorced spouse. So those are essentially 2 checks. You get them on the same day, so it looks like one check. It is one direct deposit, but people are missing that second benefit amount. So that's why I did that one. Yeah. So, all right, let me take that one out of here. And so some YouTubers out there have moderators and big studios and stuff like that. And if you like that stuff, then yeah, this is not the place for you. This is based on decades of inside experience. Old school, only 117 out of 372. Please hit the thumbs up button to push this info. Yes, please. Thank you. Thank you very much. I appreciate it. Yeah, this is how the information gets out there. I just sit here and do these stupid videos pretty much every day, but I could just be sitting here talking to a wall if you don't press like and save and share and subscribe and all that kind of stuff. That teaches YouTube algorithm that this information needs to get out there. So please, for the benefit of those people around you. I was wondering that too. How does that amount get separated out? Yeah. Okay. Yeah. So that's how it gets separated out. It just, all right. Thank you. My regular viewers are coming to my defense there. I appreciate it. My frontline phalanx at my fire team, we used to call it in the Marine Corps. You guys are awesome. Where is the link you added for spousal claim? It's at the bottom. Anytime I put anything, it's called independently entitled divorced spouse. So if you look at the bottom of the little chat thing, you'll see the link there. But it's called independently entitled divorced spouse. Oh, yes, Penelope, yes. Don, thank you very much. Yes. Someone on here said the other day that some churches will let you use their address to receive checks. Can you call your local area on aging office and ask them about that? Yes, thank you very much, Penelope. I completely forgot about that. Thank you. You're awesome. What an awesome community we got here. I get $1,400 a month on Social Security disability. I can't pay for essentials and survive. What can I do to prevent becoming homeless? They give, okay, yeah. Yeah, we have to stop scapegoating illegals and just, there's something that needs to be done there. But yeah, that's not my male pattern baldness was caused by illegals. That's kind of where we're descended to. That needs to be addressed. My pale anyway, but yeah, if you're only receiving $1,400, then it depends on your state. Some states are really, really cheap in terms of this. But $1,400, if that's the only thing you're receiving, then yeah, you definitely need to call your state Medicaid office and apply for Medicaid and see if they'll pay for your Part B premium, because that'll put $174 back in your pocket. And if you get that if you get Medicaid and Medicare, and it depends on what level of Medicaid they approve you for. So there's like QMB and QI and SlimB and stuff. If they approve you for the upper levels, then you're also eligible for a Medicare Advantage dual eligible plan, because you're eligible for both dual. And those are the ones you see advertised all the time with, extra benefits and grocery cards and all this other stuff. So yeah, you might be able to get some more money there, depending on your area, what's available in your particular area. So, all right. Oh, we're over an hour here. Let me see if there's let me see. Anybody I don't recognize will answer one more question. I checked one supplement company online today, and the rate increase for 2025 outrageous. Plan N 35% increase, in Plan G. Yeah, some companies that's probably one of those smaller ones. It depends on your particular state. So yeah, those are all state specific. Wow, a lot of questions here. Unfortunately, yeah, we're over time, but I'm going to be back again tomorrow. I've been doing these lives every day for over 3 months. I missed one day. I'm not going to miss tomorrow. I will be back tomorrow. If I didn't get to your question today, please cut and paste it. And tomorrow, when I go live again, when I start live, go ahead and post your question in there, and I